Hello, dear students. I am Dr. Ruchi Raj, your original guru for Prosthodontics at DBMCI MDS. Today, we are gathered to discuss the questions of Prostho that came in the recent Rajasthan MO exam. Now, this paper was conducted on 18th of July. The entire paper comprised of 100 questions. A question paper and answer key was also provided for it. And although you all would have seen those questions and the answer key, but we feel that there may be some discrepancy in some of the answers. Hence, we are here to discuss those questions. Now, pertaining to Prostho, there were only 3 questions in the entire paper, but still each and every question in any competitive exam is very important. And let's begin the discussion of the first question. What I noticed in this paper is that all 3 questions were pretty simple BDS level questions that even a third or a final year BDS student can very simply answer. So if you have done your basics, you would be able to attempt all 3 of these questions very easily. The first question is that the primary support, the first question says that the primary denture support area for a mandibular complete denture is, options are A, palatopharyngeal fold, B, buccal shelf, C, vestibule, D, buccal and lingual slope of the residual alveolar ridge. Now, the correct answer to this question is option number B, the buccal shelf area. Primary support or primary stress bearing area, let us jot it down. So a primary support or a stress bearing area, what does it mean? These are the areas that are designated in the mouth, in maxilla and mandible for a complete denture that are able to bear, in simpler terms, if I explain you, occlusal forces or the stresses that are generated and then dissipated amongst the other tissues. So these structures are such that they would be formed anatomically and morphologically in such a way that they would be able to bear all of these vertical forces of mastication, occlusion, and function, and would be able to dissipate it further. In the maxilla, that area is the hard palate. In mandible, that area is the buccal shelf area. Let us have a look at the buccal shelf area. So the boundaries of buccal shelf area are, I'm drawing it out over in yellow. So anteriorly, it is bound by buccal frenum, which means anterior point is the point where you notice your buccal frenum. Posteriorly, it is the beginning of retromolar pad area. So if this is the retromolar pad area and we divide it into 3 parts, this part where the retromolar pad area begins, that part is the end point of buccal shelf area. So posteriorly, it is the beginning of retromolar pad area. Then laterally, it will be your external oblique ridge. Laterally, external oblique ridge. And medially, it is bound by the crest of the residual alveolar ridge, and the entire area that you see in between, that is your buccal shelf area. Now, this buccal shelf area, why is this buccal shelf area considered a primary stress bearing area? First reason is the presence of cortical bone. It is covered by a layer of cortical bone, and then you will have cancellous bone underneath it. Because of this, it is able to bear the forces and then dissipate it over a wider area. Second and most important reason is that it is situated perpendicular to forces, which is considered very favorable to any load bearing capacity of any structure. So it is situated perpendicular to these forces. And third and very nice feature is that, as you can see, for example, I'll draw it out of here. This is the alveolar ridge and this is the buccal shelf area. Presently, it is slightly angulated, but as and when the alveolar ridge will resorb and the alveolar ridge flattens, the area of the buccal shelf also widens and spreads. So the area will increase as resorption will occur. Because of these reasons, buccal shelf area is considered the primary denture support or stress bearing area of mandible. If the same question is asked for maxilla, the answer would be your hard palate. Question 2, it is from cast partial dentures. Question is reciprocal arm of clasp assembly should it be active? Reciprocation is not necessary, should be passive, and always on lingual side. Here we can straightforward point it out that option B is totally wrong because reciprocation is one of the important principles that needs to be fulfilled when clasp designing. Since retentive arm is going to exert a particular force on the tooth, you need reciprocation of those forces plus bracing is required. So reciprocal arm is mandatory. So option B is cancelled. Is it always on lingual side? No. When we are doing surveying for a clasp assembly on a cast with the help of a surveyor, we have to see where the desirable undercuts are, and accordingly the retentive tip is decided, the placement of it. On opposite side of it, reciprocation will occur. So it is not absolutely necessary that it is on lingual side, but in most cases it is usually on lingual side. So when the word written here is always, that means that is wrong. Now option number A and C should be active and should be passive. To be very honest, a class being active or passive is something that is described about the retentive clasp arm in the principles of clasp designing, and specifications regarding reciprocal arm are not mentioned. But if we know the general principles of cast partial denture designing, we know that a clasp should not be active. By active, we mean that it exerts forces on the tooth. And that is something which is not desirable because it will lead to orthodontic movement of that particular tooth. Hence, according to me, the correct answer here is that the class should be passive. However, the option should be actually completed in a way that it should be passive but active when dislodging forces are applied. That is the complete statement for it. Still, the best option is option number C. Now here is a point where difference has arisen because the answer key has given answer as option number A. But in my opinion, I feel option number C is a better choice over here. Third question, again from complete dentures. Now we notice that no questions have come from FPD, no questions from implant, maxillofacial occlusion, TMD, just CD and RPD, which is something that we have even taught all of our NEET students is your primary foundation for any entrance exam from Prostho comes from complete and partial dentures. If the examiner wants to reduce the weightage of Prostho in exam, still he will select questions, he or she will select questions from at least RPD and CD, which is your foundational learning of Prostho. So coming to question number 3, again from complete dentures, and a very good simple topic. Which impression technique is used for a sharp mandibular ridge? A, minimum pressure impression technique. B, neutral zone impression technique. C, selective pressure technique. And functional impression technique. Now, classification of impression techniques can be done on the basis of a lot of different factors. On the basis of pressure, classification of impression techniques on the basis of pressure is done into 3 categories: minimal pressure, selective pressure, and you have mucocompressive or pressure technique. Minimal pressure is also called as mucostatic. Now, when we have a sharp mandibular ridge, that area needs to be relieved. And when the area needs to be relieved, it means that we want to apply minimal to no pressure onto that area. Hence, considering all of these factors, the correct answer is option number A, minimal pressure impression technique. The neutral zone technique, selective pressure technique, or functional impression techniques would not be indicated for a sharp mandibular ridge. Where would we want to give a neutral zone impression technique? We'll prefer to give a neutral zone technique where we see that the patient has been edentulous for a long period of time and you feel that the ridge is also narrow and the forces of tongue or the forces of cheek will try to destabilize the denture. The tongue is slightly larger in size, or you have a resorbed mandible. In all of those cases, you can employ a neutral zone technique so that the teeth are actually arranged in the neutral zone and it gains stability of the denture. Selective pressure technique is indicated in all of those good, high, well-rounded, rich cases where there are parts of mouth that would be able to take up the load or the stress, which are your stress-bearing areas, and some areas need to be relieved. So commonly, we employ selective pressure technique. Functional impression technique is a different technique where it says that we want to record the tissues in a state of any functional activity. Usually it is a biting down force because the people who propagated this technique said that when a denture is in function, if we are able to replicate those forces during impression technique, that will give a better denture with good stability and excellent retention. The downside of this denture is the rebound effect of it and eventually loss of retention also, plus an accelerated resorption. So that technique is also not indicated for sharp mandibular ridges. So option number A, minimal pressure impression technique is the correct answer over here. With this, we come to an end of this very small recall session of Prosto. If you have any doubts, you can ask those doubts on our Facebook and Telegram group. There is a premier group for all our students. You can tag the relevant faculties and ask all of your doubts. As always, if you have any doubts, queries, questions, or suggestions for me, please put them down in the chat box or the comment box below or even on Telegram, and I'll be happy to solve. This is Dr. Ruchi Raj signing off from this session.